New documents reveal that Canadians were forcibly confined in quarantine hotels with active COVID-19 outbreaks, and public health officials knew all about it. Do you remember if you came back to Canada during the COVID era, there was a good chance you were herded off a plane and shoved into a government-approved quarantine hotel under threats of thousands of dollars in fines or even arrest, and the justification, safety, public health, following the science. But newly proactively released government documents show the opposite was true. These facilities weren't safe from COVID-19. In fact, healthy travelers were getting infected during their forced stays, and the government, they knew it was happening. According to internal documents from the Public Health Agency of Canada, staff were fully aware of what was going on in the COVID hotels, or rather, COVID jails. From page 52 of the records, there have been several complaints from travelers claiming that they believe that they contracted COVID-19 from their stay at a GAA hotel. Now, GAA is government-approved accommodation. So let that sink in for a second. Canadians flew home healthy. Then they were locked up by the government in the name of stopping the spread, and they had to pay for their own incarceration. And then they ended up catching the very virus they were supposedly being protected from. You'd think discovering outbreaks among hotel staff would prompt emergency measures. Instead, public health officials opted to keep travelers right where they were, in the so-called outbreak zone, from page 57. I would not move travelers to another location if they had been exposed. We risk outbreaks in another hotel. So this wasn't a health policy. It was a hostage situation, and it shows the government knew the pandemic was not as deadly or as dangerous as they fearmongered it to be. At the Hampton Inn in Mississauga, 10 staff tested positive for COVID-19. Was there an immediate response? Nope. In fact, public health wasn't even aware of the outbreak until someone emailed them about it. That's right. The health agency managing the national health response for their so-called deadly pandemic had to be tipped off to an outbreak at one of its own quarantine sites. One government-approved accommodation, that's a GAA hotel, had 30 infected staff between February 28th and March 15th, 2021. 26 of them were carrying the B117 variant, in case you care. Instead of isolating everyone or moving guests to safety, the purported purpose of the hotels in the first place, well, officials just let the situation roll on. At multiple sites, public health allowed high-risk, so-called high-risk staff to return to work after negative tests without isolating them, again, which was the purpose of the hotels in the first place. Now, remember, if you got a negative test, you still had to isolate for 3 days. There were no investigations at some of these locations. There were no contact tracing protocols. The government was running a quarantine regime where staff outbreaks were treated like minor inconveniences, which is how they should have been treated for the rest of us. Well, the government treated them that way unless they hit the media, which they did. At the Crowne Plaza in Toronto, a staff member ended up in the ICU, but it wasn't public health that flagged the danger. It was an employee at the hotel who called the media. A full-blown outbreak at a hotel where healthy people are being sent is ignored, frankly, as it should have been, until the media embarrassed public health into action. Look at this. The outbreak captured much media attention when an employee tested positive for COVID, contacted CBC to inform the media of the COVID outbreak in the workplace. Hotel managers begged public health to tell them which guests had tested positive so they could take proper cleaning precautions. Public health refused, citing privacy laws. Privacy which didn't exist for the rest of us who had to divulge vaccination status to go to the pub or travel or go to work. Yet, on page 17, officials admitted that not identifying infected guests gave staff a false sense of security and made them actually less cautious, if you care about those sorts of things. So the government's own policies led to staff lowering their guard in the middle of outbreaks the government said was deadly. These weren't quarantine hotels. They were infection hotels. Let's recap. The government locked up healthy Canadians in hotel rooms at their own expense. Public health knew there were COVID outbreaks amongst the hotel staff. They refused to move travelers or alert the public. Investigations were late, absent, or ignored, and it only came out because the documents had to be released under transparency laws. Next time a Liberal MP tells you that they followed the science, ask them this. Why did your government confine healthy people in outbreak zones? Why did you hide it? How many people got sick because of your decisions? Or did you know something about COVID that the rest of us were called science deniers for even talking about? The documents prove it. This wasn't public health. It was a publicly funded biohazard in the name of following the science. For Rebel News, I'm Sheila Gunn Reid. If you'd like to help Rebel News continue to do access to information investigations just like this, you can donate at a very special website, rebelinvestigates.com, which helps offset our research and filing costs. Again, that's rebelinvestigates.com.